we have learned more about the nature of the virus based on emerging trends in China and around the world, and also based on research that various experts have done. And it is clearly emerging now that COVID-19 is different from SARS. It is different in several ways. First, the transmission mechanism of COVID-19 is different from SARS. In fact, the transmission mechanism is closer to H1N1 or influenza. And our own researchers, our own people at the National Center for Infectious Diseases, looking at the cases within Singapore, have confirmed this. Because like influenza, they have found that COVID-19 is infectious when the symptoms are mild. So this, and because of this, because of this transmission mechanism, it is also the case that COVID-19, like influenza, can spread quite quickly. Because with our mild symptoms, we sometimes let our guard down, we continue going out even though we don't really feel well, and that's how the virus transmits. So that's the first point, that the transmission mechanism of COVID-19 is closer to H1N1. The second point is that in terms of severity, COVID-19 is also different from SARS, and we've said that before. If you look at the mortality rate in China, overall it is lower than SARS. Outside of Hubei province in China, it is even lower. Outside of China, it is low too. So mortality rates are lower than SARS. If you look at the severity of the disease, various studies are being done now, but the WHO has a very comprehensive one of 17,000 patients, and they found that 82% have mild symptoms, 15% have severe symptoms, and 3% have critical symptoms. So that's quite a large study based on 17,000 patients. So it is not a mild illness at all, but certainly not of the severity of SARS. So these are the facts that we know about COVID-19 today, right? It is less severe and it is more infectious than SARS. It is different from SARS.